Oral health goes way beyond just brushing your teeth and could impact your kids' brain function, lung health, and much more. You're listening to the 2025 EMF Hazard Summit. My name is Nick Pino, the EMF guy, and this is the EMF Hazard Summit, Protect Your Children. Welcome. In this presentation, filmed in person at the Deeper Healing Clinic in South Carolina, biological dentist Dr. John J. Palmer teaches us about the dangers of fluoride, using metals in the mouth, cavitations, and much more. It will empower you to take a brand new approach to your kids' oral health. Dr. John J. Palmer is a pioneer in advanced dentistry, a national speaker, and a board-certified naturopathic physician. He's one of the few professionals trained in the safe removal of amalgam fillings. I'm here with Dr. John Palmer, who practices holistic dentistry. Dr. Palmer, thanks for being here.
Thanks for having me. It's a pleasure.
So what is holistic or biological dentistry, and how does it differ from what could be called conventional dentistry?
Well, we kind of leave dental school and we just think we're working on the head. And that's totally not true, because health basically starts in the mouth. Everything that happens in the mouth occurs systemically throughout the body. If you have infection in the mouth, it's going to cause inflammation throughout your body. If you have metals in the mouth, they're going to cause changes in currents, or they're going to leach out into the body. Say mercury in fillings can go directly to the brain. It crosses the blood-brain barrier, and it goes throughout the body. So a holistic dentist realizes that what he does in the mouth affects the whole body. So we try to eliminate the toxins that we can, such as mercury, fluoride, and we try to use the most biocompatible dental materials that we can.
So let's talk about fluoride. I think a lot of parents listening to this interview have no idea that fluoride is something you should avoid. It's pretty much in every toothpaste still. It's in the water. So how should we think differently about fluoride, and why?
Well, the fluoride in the water is a very strong acidic form of fluoride, a man-made fluoride. It's a waste product, fertilizer industry. So they just like to sell it to us and put it in our water to get rid of it. It really does nothing but cause fluorosis in teeth. Mm-hmm. It causes fluorosis, which is mottling of the enamel, brown stains in the teeth. And if it's doing that to teeth, it's doing that to bones. So the EPA has recently lowered the amount, but they haven't gotten rid of it yet. Hopefully that's going to happen soon. There's a lawsuit that's before the judge at this point in time that we expect is going to get ruled on in the next few weeks. And that may end fluoridated water is what we're hoping.
Really? Well, that would be massive news. I've been following the case of fluoridated water, and I was especially happy because it's not in the water in Montreal where I live. But whenever I travel to the States, one of the first thing I do is I go on the internet and search fluoridation and then the city everywhere. Because I want to, well, pretty much everywhere. So I'm really glad to hear this. But what about toothpaste? Because a lot of parents are under the impression that to get the right type of toothpaste that helps strengthen your teeth, you need fluoride. Is that the case? Is that not the case?
Well, in my opinion, no.
Okay.
That's Spanish fluoride, different form. It's topical fluoride. It does kill bacteria because it's so acidic. It is, and it's a toxin, so it does kill bacteria. But even the ADA has one of their latest studies shows it does not increase your resistance to decay. And the amount of fluoride in a tube of toothpaste, if a child ate that and swallowed that, they would be in an emergency situation, and they'd be at the hospital for poison incidents. It could kill them. So it's toxic. It's also used in rat poison. So, it's very effective rat poison, but it's not effective in the human body. Fluoride is not used in any biochemical pathway of the body. and it's as far as the water fluoridation, or it's a halide and competes with iodine, which the thyroid needs, which I think is one reason we have almost generalized thyroid disease in our country. It's because of the fluoridation. It also just released in a study. I can't remember who did the study, but it was one of our toxicology in the government organizations. And they show that we have a reduced IQ in our country due to fluoride.
I heard about that, and that's
NTE, I think so.
And that's just one of the toxins linked with a reduction of IQ. There's other heavy metals, for example. So it's kind of the perfect storm that our children are getting these days. I'm just thinking about the fact that there are heavy metals from pipes in Montreal and the municipal water. So that's another aspect to this. But going back to toothpaste, if you were to choose a toothpaste with no fluoride, is there an ingredient that could replace it, or is there brands or certification that parents should be looking for?
There are many more biocompatible forms of toothpaste. And most of them are going to be herbs in it. May have peppermint in it, which helps kill bacteria. But the true purpose of toothpaste is to just get you to brush a little better. You could brush with a brush and debride the teeth with that, remove the plaque. You don't have to have toothpaste itself. There are toothpastes that have hydroxyapatite in them, which are supposed to help remineralize areas that have initial decay. I've seen some good results, some results that don't work. We generally use one that has a little hydroxyapatite in it.
Okay, and what about this thought that I heard on the internet? So that's not from an expert or anything, but I read that if you put too many essential oils, even natural one, oregano, peppermint, these are strong antimicrobials. And the argument was made that maybe we don't want to use those in an abusive manner because of the oral bacteria that are supposed to be there, right? That microbiome.
Right.
Is that a valid concern?
It can be anything can be overdone. Okay.
Sure.
And that microbiome is very important. We have to have them. The good guys, we have good guys and we got bad guys. And if you can keep the balance right, you'll have periodontal gum health. Your gums will be healthy. If the bad guys overtake the good guys, you can have gum disease and start to lose bone and lose teeth or in cavities. So it all comes down to really what we're putting in our bodies, really, and how we're taking care of ourselves. But diet is probably more important in preventing decay than maybe even brushing your teeth 4 times a day.
Yeah, well, I'm aware of the work of Weston A. Price and the link between the food you eat and then the development as a child of your jaw. Can we talk about that a little bit? What are you seeing these days? Are there even children that have normal straight teeth? Because I see that most people have crooked teeth. I used to have very crooked teeth. Then I had Invisalign. But so what is the state of oral health in children in these years?
We see a lot of children, and we want to catch their growth and development problems early, and we see a lot of growth and development problems. I mean, Weston Price is exactly right. Our processed food diet, our softer foods diet, our inability of our medical profession to realize in infancy that tongue ties are very important and how functionally important the tongue is in growth and development of our kids. So kids can have sleep issues because they're not developing properly, their airways are narrow, and those sleep issues can lead to ADHD, poor behavior, bedwetting, a list of symptoms. And if they could just breathe through their nose and sleep better, we see them go away. So early intervention for that growth and development, well, the earliest intervention could be 2 or 3 days after the infant's born. They should have their tongue evaluated, especially if the mothers are nursing, which hopefully they are, very important, but they have to nurse properly. And if they have lip ties and tongue ties, which are just where the tongue's attached to the floor of the mouth, is supposed to be free, or where their lips are attached too tight, and those need to be released so they can have a success as they're trying to nurse. Very important. So a good nursing will help develop the jaws and the upper roof of the mouth, which is the floor of the nose. So if you've got width there, you'll have width through the nose to breathe. And as the jaws develop, then the lower jaw can come forward where it's supposed to be, and your postpharyngeal, behind the tongue, airway will be opened up. Makes a world of difference.
And you talk about airways. One of my first thoughts is there a link between the development of the jaw and airways and then the risk of environmental allergies, which are so common these days in children?
Yes. You breathe, you're supposed to breathe through your nose and not through your mouth.
Mm-hmm.
When you breathe through your nose, you create nitric oxide from the sinuses. You warm the air, gets warmed, and gets moisturized. You'll have less problem with allergies. You breathe through the mouth, it's dry air. And you don't create that nitric oxide that's so important. So that can definitely have to do with allergies.
Wow. So these are links that we don't initially think about.
No.
But so let's go through maybe the developmental years of children at different ages. Are there specific things that you look at? You talked about babies. I remember my wife and I consulted because the latching wasn't proper when she was trying to, give milk to the baby. And they did talk about the fact that babies need to latch a specific way for development. What about young children? I have a lot of concern that things are a little bit too interventionists in medicine, where you see a problem and you treat it right away. And my approach as a dad would be to step back a little bit and wait to see how things develop. Does that make sense?
Mm-hmm.
I know we had a discussion prior to this, and you told me that this is a little bit the approach of biological dentistry. So when you see a child, what do you look for in the early years to say, okay, this child will develop properly? Is it how teeth are forming as the first teeth come out? Are there signs to look for?
As a parent, we ask them to observe their child closely and see if they're breathing through their nose.
Oh.
Or if they're kind of open mouth most of the time, breathing through their mouth. That's a very important sign. Check them when they're sleeping. They may sleep all night, but that doesn't mean they're sleeping well. For a child, sleep apnea is if they stop breathing one time an hour. For an adult, it's 5, and that's just an insurance draw the line in the sand kind of thing. But for a kid, one time is too much. So you observe them when they're sleeping. Now, visually, if their teeth are crowded, if they're coming in crooked, they haven't developed like they should.
Mm-hmm.
Yeah. And that can be treated early. It can be treated with removable appliances. It can be treated with plastic clear aligners. And you can what your goal would be to avoid having to have brackets and full banded orthodontics, before they're 12. That'd be done, have it fixed. Or you can treat it later. But luckily, many orthodontists now are considerate of airway when they're treating.
Okay.
So if you're going to wait, try to find an orthodontist who also is cognizant of airway. Got it.
And so that's the first time I hear about watching my child that's sleeping and how he's breathing. To me, this is really surprising for me, this information. And what about interventions during childhood? One intervention I had in orthodontics is I got, I think, 6 teeth removed that were baby teeth that wouldn't fall. Maybe my jaw was too tight, I think, and they needed to make space. I also know that a lot of children and teenagers are getting their wisdom teeth removed. So are these interventions something that is healthy, or there are healthier ways to do them? How do parents need to think about those?
Taking baby teeth out that are over-retained, that's fine.
Okay.
Because it's got to allow the permanent teeth to come in. But to remove permanent teeth to create space is hardly not done anymore. It used to be done a lot.
Okay.
And what it created was retruded lower jaws, which made airways smaller and created breathing problems. So as far as the wisdom teeth go, I'm not a big advocate of getting wisdom teeth out just because they're there, just because they're impacted. When there are indications, they should come out, but I'll let the parents, usually of the children, decide whether they want to do it or not. But we just routinely don't advise it because we can do it and because we can charge for it. And the other side of the coin, holistically, some holistic dentists, practitioners will say, well, that's blocking if they're impacted, which means they're still in the bone, that's blocking the meridian. Well, the meridians of the body, the electrical circuits of the body, the teeth are the pathways to those meridians. And as we chew, we swallow, every time we swallow, our teeth touch, that creates kind of an ionic pump that makes the electrons flow down those meridians. That's the Chinese theory of medicine, acupuncture, and that kind of thing. So they're saying, well, that meridian is not functioning or it's blocked. Well, I don't think it's blocked. I just think it's not pumping. So if I would like to give the kids plenty of time to develop and see if those wisdom teeth are going to come in. And we got tons of adults who still have their wisdom teeth, and they're fine. And then I also see lots of adults who've had their teeth taken out when they were teenagers, where we have cavitations in those areas of the bone, which are chronic infections in the bone in those areas.
How do these cavitations show up? Is it that you're in pain, or could that be under the hood, silent?
They can have some pain systems. They call them Nico lesions when that happens. Those are the rare ones, actually. You only see them if you're having trouble getting rid of some kind of chronic inflammation. I'll get referrals from Dr. Bowersmith and other doctors, and they'll say, nothing's working. What's going on? And we find usually cavitations. They're places where moles can hide, viruses can hide, bacteria can hide. They don't have very good blood supply. So we have to go in surgically and clean those out. And when the wisdom teeth were removed, what probably happened is they did not get a good blood clot, because that's the first stage of healing for bone. And by not getting a good blood clot, a lot of patients say, yeah, I had a dry socket, which is loss of the blood clot. I remember how bad it hurt. And so that's just, well, I know that's what was caused. You lost the blood clot. That's why this thing's here. So they just don't get good, complete healing with a good vascular supply to that area of bone. And viruses get in there. Mold exposure, moles can hide in there. We know there's anaerobic bacteria in there, all the bad guys. So when we clean them up, or if you're going to get your child's wisdom teeth out, you should try to find a doctor who's going to use platelet-rich fibrin. That's a blood product that we can take. We draw blood in the office, put it in a centrifuge, spin it down, and we get these nice big pieces of fibrin. That's the clot. They also have platelets on them. They have stem cells on them. And we fill those voids of the bone with that. And so we got that initial blood clot. Even when you're taking teeth out that are not impacted in bone, there's always a hole. Because and you can't cover it up with tissue because the tissue doesn't go all right. It goes around the tooth. It doesn't cover up. So when we use platelet-rich fibrin, patients usually have stopped bleeding by the time they hit the parking lot.
Really?
Yes, it's fantastic. And they heal faster, with less pain. It's one of the best things that ever happened to me in dentistry is to start using this stuff.
That's massive. And it's biocompatible by nature because it comes from you.
Yeah, it's from you. It's yours.
We just return it to you. Just displacing.
Borrow it in a minute and return it to you.
Yeah, exactly. Wow. It's a very elegant way of using the body's natural healing abilities and then using it in a spot in the mouth where things are not healing easily or can be stuck in that chronic state of inflammation. I heard about chronic inflammation in the mouth, cavitations, and then neuropsychiatric effects. Are you seeing children or teenagers having interventions and then starting to have, I don't know, ADD, ADHD, or anxiety, or things that could kind of rhyme with inflammation of the brain?
Well, we kind of see it the other way around.
Okay.
As we find a reason for inflammation, whether it's sleep and breathing, mouth breathing versus nose breathing, and we get that corrected, then we see the ADD go down, ADHDs go down, and those kind of things, or even bedwetting. Bedwetting might go away in a week if we can get that correct.
How are those related?
It all causes reduces inflammation. Those are causes of inflammation.
Yeah.
So it reduces the inflammation. I'm not sure if we know the direct cause or the direct reason the bedwetting stops, but it does. It's just nice.
Something with the nervous system.
Yeah, it's got to be through the meridians of the body.
Wow.
The nervous system.
Are there other interventions that we didn't talk about that parents should hear about, that maybe are done in a certain way that you consider it should be ameliorated or it should be changed in dentistry? Because I know things have been evolving so much with biological dentistry. You mentioned about materials. What do we need to know about materials? If something is installed in the mouth, there's going to be a retainer. Are there certain materials you would avoid or recommend over others? Well, you want to avoid using metals, any metals, as much as you can. We don't use any permanent metals in the mouth. Some of our orthodontic appliances, unfortunately, have some metals in them, but they're usually removable appliances in short term. Metals in the mouth are definitely block the meridians. And say a titanium implant, which is a metal implant, they've been shown to release electrons from the implant body, which will end up being deposited in bone. They've also been shown, and this goes for mercury fillings also, if you're holding your cell phone and talking on it, the metals on that side of the body will actually increase in temperature. Well, increase in temperature causes inflammation in the tissues. And it also increases the release of electrons as it heats up, and or increases the release of the mercury vapor, which always comes off, but it increases that mercury vapor. So that's one thing that those electromagnetic fields do to the metals. So we just want to eliminate the metals as much as possible. But I do caution you, if you want your mercury fillings removed, you need to make sure the dentist knows how to do it safely. There's an organization called the International Academy of Oral Medicine and Toxicology. We've got a protocol called SMART that is used to protect the patient. The team members are all taking it out. And there's also an organization, the IABDM, that has kind of the same protocol, because we kind of copied ours, but called it a different name, which was fine. We didn't mind. But those two organizations train dentists how to do it safely. So you can go on their websites and ask questions. Don't just blindly accept, because they say they're smart, that they're going to do it properly. If you go in there and you're uncomfortable and you don't think they're following that protocol, you should go find another dentist. What could happen if someone gets their mercury fillings, or they call them silver fillings, almost to hide the fact that it's mercury, right?
True, so that's what they do.
These metal fillings, they get drilled, and without the proper protocol, what could happen?
Well, you get a huge exposure when you do that. Because as you're drilling it, the drill's got water spray to try to keep the tooth cool, but it creates a particulate and a vapor, an increased release, which you will breathe. And if you are not being protected or have your airways not protected, 80% of that vapor and particulate is going to go into your lungs. Some immediately crosses the blood-brain barrier, and 20% of it is exhaled. But it's a huge exposure. I mean, really, really big. I don't want to get tied up into how big that can get, but it's real big.
Yeah. Well, I heard, that amount of mercury should be enough that you get to call the EPA for cleanup or something.
It doesn't take much for that.
It doesn't take much, right?
Not much for that.
So imagine if it's in your mouth. I mean, it's definitely something that needs to be handled with care, and that's something I've been talking about online for 15 years. And each time I tell people, yes, removing mercury amalgams could be a good step, but please be careful with this, because
That's
I
right.
did hear from people who told me, I got very sick after the removal and I regret having it done this way.
And it might be 3 days later, it might be 2 weeks later, and they don't really connect it until later when they've probably been diagnosed with some heavy metal issues. And they go back and say, yeah, I remember that. I was pretty sick after I had that removed.
Got it. And before we leave, I just had this question almost for myself as a dad. What's the right amount of, or the right frequency to brush your children's teeth and teach them how to? And then what about flossing, right? What is the view of, your medical experience as a biological dentist?
Well, the toothpaste companies created the interval when you should come get your teeth cleaned at the dentist, which was twice a year.
Yeah.
That came from an old commercial for toothpaste way back in the 50s.
Okay.
So, but you should brush your teeth after you eat, every time after you eat.
Okay.
Because that's the biggest time that the plaque can pick up all the food. Everything's there to create those cavities or grow those bacteria. Mm-hmm. So typically you shouldn't brush every time you eat. Now that's not possible in some situations. So at least when you wake up in the morning, after you eat, when you're in your home, and before you go to bed, that's the best time to start getting those bacteria off the teeth and knocked down before you go to sleep.
Got it. And what about flossing?
Flossing once or twice a day.
Okay.
And some patients, honestly, don't have to floss. Or you can use an irrigation device in place of flossing. Is
that the water pick that they call?
That's one of the brand names.
Okay. I didn't know it was a brand name, but I was not aware. I had never used the water pick, but I do floss a lot because I realize now my teeth have been replaced using Invisalign. Mm-hmm. And now if I eat a steak, for example, I could get an infection in the gum in a specific spot. And that happened twice. Yep. I had to go see my dentist once because of it. I was getting very concerned, a lot of bleeding. So it forced me to floss twice a day. So I do it now.
You could also ask him to tighten up that contact for you between those two teeth.
Well, exactly. Yeah, they're still working on it. Yeah. Is there anything that we haven't talked about that you think parents should know about oral health? Any intervention that you see out there that parents need to consider? Or
I think they should also be aware that we use ionizing radiation, which is our x-rays, which have a cumulative effect on the body. And that a lot of dentists take x-rays when the insurance companies will pay for them. I mean, I hate to say it, I'm already probably in trouble with most of my colleagues out there, but I only take x-rays when we need them. And we have to take x-rays because we have to have x-rays to do any kind of work, or the state board would come down on us. If you do some work with no x-rays, state boards would take our licenses.
Okay.
But you don't have to take them every year, especially in our adults. I mean, I've got adults that never had a cavity. I don't know how they did it. Genetics, good saliva, took care of their teeth, maybe didn't, but they still don't have a cavity. Mainly good diet. And I might take an x-ray on them once every 5 years.
Okay, so minimizing ionizing radiation.
And we have cone-beam x-rays now, which are 3-dimensional x-rays. And they're advertised as low radiation. Well, they are low, but they're higher than just, say, a regular 2D x-ray. Okay? So it's all relative. Well, lower than what's what I say. As low as you can get it and get the results is what low radiation means.
Yeah.
So we limit how many x-rays we take. It's just sometimes it drives some of my hygienists crazy, or some of my younger dentists in the office crazy. I said, you don't need another x-ray. You're fine.
Yeah, and being on, if that's it's called in radiation, the ALARA principle, as low as reasonably achievable.
Right.
If it's reasonably achievable to avoid x-rays that are not useful, that serve no medical purpose, you're just doing it to be on the safe side or whatever, there's no real purpose, well, you avoid them. And if you need them, you get them. But I think it's just the smart approach to do, instead of one approach where you have an x-ray every 6 months just for the sake of it, So thank you so much. This has been very enlightening for everyone listening. And I thank you for your presence today.
Thank you.
I really hope that you liked this presentation. If you want to take action on what you just heard, you'll find links to everything that was mentioned by our guest speaker right underneath this interview. If you love the summit and want to own the recordings in audio, video, and written form for all of these 2025 interviews, make sure to click the buttons on this page to get the 2025 EMF pack. This EMF pack is heavily discounted during the summit launch and for a very limited time. Remember that every purchase supports my work as an independent citizen journalist, as well as the nonprofit partners that are associated with this summit. Thank you for your attention and support, and I'll see you in the next presentation.